If you've battled migraine for a while, you know this disease can strike out of the blue. It leaves you and your plans just reeling. It can throw you off balance both literally and figuratively, and when your experience is far different than your expectations, well, that can be the worst.
Most people kind of expect migraine will get better with age, but as today's guest can tell you, that's not always the case. He juggled migraine and a highly stressful job, then retired thinking he'd be able to restore his health. Unfortunately, that wasn't the case. But what he discovered was a more stable, steady approach to managing the disease that may encourage you to do the same.
So, welcome to Me versus Migraine, our series where we dive into compelling stories of real people who are battling this disease. And in each episode, you're going to take away insightful nuggets to make living with migraine a little easier and less painful. I'm Paula K. Dumas, producer of Migraine World Summit and editor-at-large at Everyday Health and Migraine Again.
I'm Carl Cincinnati, founder of the Migraine World Summit, executive director at Migraine at Work, and director of operations at Migraine and Headache Australia.
And in just a minute, you'll meet our friend and patient advocate, Bruce Shaw. But before we get started, we'd also like to thank the sponsor of this episode, Amgen, a company that strives to serve patients with therapies that have the power to restore health or save lives.
As a lifelong educator, Bruce's experience with migraine is a masterclass on living your best life with an unpredictable disease. On a near daily basis, migraine has challenged Bruce to manage dizziness, visual auras, vestibular symptoms, safety challenges at home and at work. He'll share how this condition has evolved since it began and what his next steps are.
Despite the bumpy road that he's traveled, Bruce generously volunteers at the Migraine World Summit, co-leading a team of advocates who are focused on communications. And when he's not managing his team, Bruce can be found cycling in the fresh air or hanging out with his grandchildren. Bruce, welcome to Me versus Migraine.
I'm glad to be here, so thank you.
So to start off, Bruce, when did you start experiencing migraine?
So I'm just shy of my 77th birthday, and it was probably, I don't remember the exact time, but pretty much in my early 50s, somewhere in there. And it's a very simple story. I was sitting and doing an interview. As you said, I worked in schools all my life. I was an teacher, then an administrator, and then I headed two schools. And so in the second school that I headed, I was talking to a great candidate. And I remember trying to be as, you know how you are when you're trying to hire somebody, you're trying to be as charming as you can be and let them know that this is going to be a perfect fit. And then suddenly, while I'm looking at her, her head rises double. So I'm looking at two heads standing in front of me. And her shoulders went up, so I'm looking at two sets of shoulders and two sets of arms. And then some zigzag lines start up and down like this. So I finished the interview as quickly as I possibly could, having no idea what was going on with me. And immediately when I ushered her out of the door, by then I was back just to zigzag lines, but I could see better again. I called my doctor. My doctor was highly responsive and got on the phone with me and said, "Sounds like you're having a migraine aura to me." And the first thing I thought of was, I have no idea what a migraine aura is. I'd never heard of it.
So what did you think was happening to you? Did you think you were, having a stroke or a brain aneurysm?
Yeah, Paul, I wasn't thinking. As far as I'm concerned, I was absolutely positive I was about to die. Right then and there in my office, just kind of like that. And I could imagine the 500 kids in my school all streaming by me to say goodbye. I was positive I was having a stroke. And when I called the doctor's office, my primary care physician, I explained to the desk what was going on, and he said, "Migraine aura." And my response was, "What's that?" I was familiar with migraine because my mother had it, but aura is a word I didn't know associated with migraine.
So once you had your first attack, obviously you had another one. What started to happen from there? Like, how often were you experiencing them?
Yeah, so they were pretty episodic at first, no longer, but then they were. So I can sometimes get an aura that lasts, had them up to a half an hour long. Very disconcerting when that goes on because I can't drive, as an example. I can't walk anywhere. I can't do much. And I've had them that last, again, it's often that that vertical double vision. I've had many that last just like that. I'm driving down the highway, all of a sudden it goes like that. And immediately afterwards, I get lightheaded. I'm driving down the highway and I'm in a great mood because we're about to go out and do something really fun. And suddenly I have to say to my wife, if she's in the car with me, can you drive? Because I'm not sure that I can. I find myself struggling for words. I find myself sensitive to light. My wife answers me. She's pretty hard of hearing, so she often talks too loudly. I find myself very struggling with her voice at that point because it's too loud. I get clumsy. So I get out of the car and I'm walking around and I trip against the door. Then I trip against the back of the car. Then I try to get into the car and I miss my seatbelt.
That's frustrating. How often do these attacks come today?
Okay, today I'm pretty chronic. So they often will last 4 to 7 days long and probably 16 to 18 days of the month.
Have your doctors talked to you about vestibular migraine or Alice in Wonderland syndrome?
Yes. So again, I'll go back to this primary care physician. He did a quick examination and he decided that I had not had a stroke. He was able to tell that. And he did 3 referrals at that point. So referral 1 was to an ophthalmologist, just in case something was going on with my eyes. Referral 2 was to a neurologist. And that I also was able to get in because of his referral within the week. And the third referral that he made was to a headache specialist, a neurologist as well in the Boston area, who he said it's going to be 9 months to a year. And it was almost 9 months to a day before I got to see her. So the ophthalmologist said nothing was wrong with my eyes. I was probably having a migraine aura. I went to the neurologist. He said, you're having migraine. And he immediately gave me 2 drugs. One was amitriptyline, an antidepressant, sometimes used for migraine preventive. And the second was sumatriptan, which is used, of course, as a acute abortive medication. But of course, I don't get headaches.
So let me double click on that for a second. First of all, your first symptoms were in your 50s, which is a little unusual.
Little unusual, right.
And then you have no headache. Your most disabling symptom sounds like it's this visual aura and clumsiness and balance.
It's the clumsiness, it's the dizziness, it's the brain fog, it's aphasia at times where I can't come up with the right word. It's just gone. Something very simple. There's a light in front of me and I can't think of the word light.
So I have migraine with aura as well, Bruce. And when you were describing how something just comes up really quickly and then you can sort of, symptoms can follow thereafter, that's actually very similar for me. I've had vertigo symptoms in the past, but they're nothing like what you described. But what I see, which is almost like a warning, sort of 24 hours in advance, is just a colored dot in my field of vision that kind of sort of scratches across my vision. It's kind of a strange, like almost like a comet, but doesn't follow a similar, straight line like a comet. It kind of just weaves around a little bit and sort of fades off. And that's like a little cue to me that's like, Carl, if you don't intervene, if you don't sort of de-stress, like walk away, take a break, settle down, make sure you have a good night's sleep.
Yeah, so your prodrome experience, so I have them as well, but my prodrome experience tends to be within minutes or seconds before the full, what my form of migraine hits. So it's often things just come out of the blue. So again, it's the lack of resilience. So I bike regularly. I'm downstairs. I'm taking off my bike shoes and I can't get them off. And all of a sudden, I'm really angry at my shoes. It's my shoes' fault, right? When that happens. And when I feel that, I know something is coming on. Or again, it's the clumsiness, So my wife is a ceramic artist. I am not allowed to touch her work.
I can see why.
Stay out of the room, Bruce.
I
Do
have
not.
dropped enough of it over my lifetime, and I am not allowed to touch her work because I will pick something up and drop it, including some of my favorite things.
I think that whole clumsiness thing is something that people don't talk about very much. It's kind of difficult to identify, but there are times when, really coordinated people suddenly just can hardly walk, can hardly, keep their balance. Or just like we talk about the word salad and getting your words mixed up, it's like your balance gets off. Did you get an actual diagnosis of vestibular migraine when you saw that headache specialist?
Yeah. So when I finally got to the headache specialist 9 months later, this is an interesting story as well. So I'm dealing with the amitriptyline, but not particularly well. I've tried the sumatriptan a couple of times, but it really sent me off into a different world. It was not a good fit at all. So I get to the headache specialist, who's I still use. So this is 20 plus years we've been together. And I get there and she does a full neurological examination, unlike the first neurologist. She asks about what other medications I use. She asked about my experience with the other neurologist and what had happened with the amitriptyline and with the sumatriptan. And she said, "You have vestibular migraine. Do you know what that is?" So she explained it to me and she said, "It's why amitriptyline and sumatriptan are absolutely uncalled for." And so then she leaned forward at me and she said, "I just want to do one thing. I want to apologize on behalf of all my other neurologist headache specialists for the neurologist that you saw."
Mm.
Fascinating.
Yeah, I mean, people don't realize the difference in training and skill set that, various doctors have with their subspecialties. So this is a good example of if, somebody's listening and you've got a complex case, you need to see a specialist, even if it takes you 9 months to get in, and even if you have to travel to get there.
Right. And my headache specialist also lives with migraine in her life, which makes things interesting as well. Is probably the reason she went that way. She said, "You should see me crawl into my room and crawl under my covers and pull down all the blinds because I need to do that sometimes." So the empathy is there as well.
That's awesome. Now, I am trying to imagine having the constellation of symptoms that you describe and trying to run a school with hundreds of children and teachers and administrators. Give us a picture of other days at school and what you did when migraine kind of threw your entire day off balance.
Right. So I retired in 2010. I actually continued to work as a consultant for about 7 or 8 years after that, but much more in control of my time than I was before that. In that time between whenever it was, 1998, 2000, and 2010, my migraine life was really very episodic. So I had occasional situations that were like the interview that I did, where I would be there someplace and, the double vision started or the clumsiness started or whatever. I was glad I wasn't a teacher with 20 kids sitting in front of me trying to figure out how to manage that. There is no such thing as a quiet child, except when you ask them a question that has an academic focus to it. So a lot of the way I dealt with that was either just going into my office and having her reschedule things. And I was able to talk with her about what went on with me.
So you were a school principal. Can you tell us about what the hours were like and sort of the responsibilities and the pressures that were faced in that role?
The hours were between never ending and an eternity on a daily basis. So you both had jobs that were like that, I believe. And so mine was certainly like that. So I worked in the private school world in two schools, and I was the head of two different schools. So I was a school head for 26 years. And as a in the private school world, it's like being a principal and a superintendent in the public schools here in the United States all at once. So you're responsible for kids, you're responsible for curriculum, you're responsible for all the faculty and staff, you're responsible for parent relations, you're responsible for a board, hiring, obviously, evaluation. And it's not that I didn't have other people doing some of this work, but everything came back to me. And then, of course, there was fundraising because there's a private school. So the pressure was fairly intense. So my hours were long. I had a lot of, as I said, I lived on campus. I still haven't figured out all my triggers, quite honestly, of what gets me off. I have no idea why I wake up one morning and my head's off. But one of the things that I learned, my headache specialist told me this. She said, you actually have been having some migraine activities since your 20s. And what would happen would be this. I would have a long week of work. Friday night would come. We would go out for dinner, find a babysitter for the kids, stay up a little later than normal. And then I would ask my wife if I could sleep a little later in the morning. And she would generally say, okay. And then I would wake up and I was tired and my head was off and I'd feel a headache that wouldn't respond to, ibuprofen or anything like that. But it was without any of this visual stuff. So I would just be off for a day. She said that was migraine.
Yeah, I do think that migraine morphs over the course of your life and it kind of expresses itself in different ways. But as you tell your story, I'm thinking, boy, that period when you were in your 50s and you're managing 200 staff and, long hours, the stress level has got to be greater than what you're experiencing today. Yet today, the severity of your disease is worse. Is that right?
Yes. So I took a variety of preventive medications over the years. And topiramate was working for me for a while. It was really keeping these episodic experiences to a minimum. Then they started to pick up for whatever reason. And my doctor, like all doctors, therefore increased the dosage. So then, right towards the 2009-2010 school year, the number of these migraine incidences of the type that I get started to increase. And then in the spring of that year, I suddenly had a huge amount of facial pain. And I was diagnosed with trigeminal neuralgia, which also was something I'd never heard of before. And it's something I wouldn't wish on my worst enemy. So people I know who have migraine, terrible migraines, and trigeminal neuralgia said that trigeminal neuralgia is more painful and worse. And women who have had childbirth have said far worse. So it came and went, came. And then it was happening many times a day. And for the last 6 weeks of my work, I was mostly not there before I retired. And the doctors gave me 2 different kinds of anti-seizure meds, and I had to stop the topiramate because I couldn't, my body didn't allow me with that. I had surgery. I had neurosurgery in the fall of 2010. So they placed a silicone disc in my head because it's caused by the trigeminal neuralgia is caused by the throbbing of a vein or artery against your trigeminal nerve. So it's constantly going like that. So touch was the worst for me. Touch and, somebody being so sweet, so nice to see you would set me off. Talking would set me off. Drinking would set me off. Eating would set me off. Very difficult. And after the surgery, which stopped it, which is good, two things occurred. One is that for 2 to 3 years, I was off of all medications. So no, I stopped the anti-seizure meds that were for the trigeminal neuralgia, didn't go back to the topiramate, and I had no migraine experiences. Then they started up again. So that was about 2013. And since then, they have just ramped up and up and up till now they represent the majority of my life experience rather than the occasional one. And I don't know why.
Did you retire because of the escalating headaches and trigeminal neuralgia, or was your retirement sort of already planned?
I retired when I was 65 and it was planned. I was ready to give it up. Right.
I can imagine. Let's talk about today, because it sounds like you've been battling this ever-changing opponent for decades and decades. And I think sometimes when you have the chance to step back and look, you can see signs of migraine at different phases of your life when it was presenting differently, as you did with your 20s. So today, how are you taking this more slower, steadier approach to managing your disease?
So there's a number of things that I have tried to do. It has not diminished the number of days that I have some kind of symptoms. And I don't know whether it helps or not. I have been taking a variety of preventives over the years. I have after I went back to topiramate, and then when that was done, it didn't work anymore. My doctor gave me Dival Pro X, and when that didn't work anymore, she tried venlafaxine, and when that worked for a while, and then when that didn't work anymore, she tried Aimovig, and that worked for a little while, and then when that didn't work anymore, she tried Emgality, and that worked for a little while, and then when that didn't work anymore, she tried Vyepti, and we have just quit that. Migraine in me. So the me is like a child in a boxing ring, and migraine is like the Hulk at the other side of it, right? And the Hulk doesn't move as fast as the child in me does. So I come out of the ring, the bell rings, and I come out and I'm fast and I'm agile and I'm young and I'm much better than the Hulk. That's me in preventive medication for the first month or two. And then I get tired or something like that. And then the Hulk gets me and pins me to the floor every single time. So I am between medications right now. I am off of everything preventive at the moment.
That's so interesting. I had a very similar experience when I was struggling with chronic migraine, and I love that analogy that you have with the child and Hulk in the ring. The way that I described it was, it's kind of like this honeymoon period wearing off. And I don't know if it's still the case, but I would go into these treatments really hopeful with a positive attitude and wanting it to succeed. And sure enough, after a couple of months of taking it, I would have a great response initially, and then it would sort of drop off and it would be back to where I was or worse. Yeah. And it was kind of like this continuous cycle of just kind of working through the treatments. It was emotionally, it took a toll.
Yeah, it does. There's no question.
I think there's a little bit of this placebo effect of you believe it's going to work, and that helps it work for a while. And then once you get to kind of a steady state, you have a better opportunity to assess it and say, is it actually reducing my frequency or intensity or my most bothersome symptom? Right. And that's when which is why people have to give, especially preventive medications, a good long test before they abort and move on to the next one.
Right.
To see if it's actually helping or not.
I have tried a number of lifestyle changes, and one of the things, I didn't know that they've diminished the number of days that I experience my type of migraine symptoms, but one of the things that they do is they actually make it more manageable. So there's several things. Doing the work with the Migraine World Summit as an example, and I volunteer at 2 other places as well. So I've got 3 volunteer stints going on, very different than one another and very different than what I did in education. And they take my mind off myself. which I find is actually quite helpful. If I'm thinking about something that's other than me, um, that's a good thing. You see paintings in the background. Those are all mine. I paint. And it's actually a really good thing for me. Often with the migraine, I will go downstairs and I'm feeling lousy. I have a little studio downstairs, the emphasis on the word little. And I'll sit down there and I'll start to paint and I concentrate. And I'm concentrating on what's in front of me rather than what's inside me. And that helps. I gave up meat. So I became a vegetarian. I gave up most of my sugar, not all, but I try to be good, you know. So I gave up a lot of sugar, and gave up other kinds of foods. I just went completely into whole grains, no meat, no fish, nothing like that. So I try to eat well. Um, Sleep is a trigger for me. So we learned that earlier, and I know now that if I don't that I need to go to bed at the same time. I need to wake up at the same time. So here I am, well retired, almost 77. I set my alarm every day so that I can go to bed, wake up at the same time in case I should want to sleep longer. I've tried mindfulness, not so successfully, but I try it, breathing and doing things like that. And so I find that those things, they all take my mind off of me. Maybe that's the best way to put it. I can go for a bike ride in the morning, even on a migraine day where I get lightheaded. So understanding lightheadedness and balance, and what it's like. If you catch me on a bad day with a migraine and you're walking behind me, my daughter or my wife will tell me that I look like I'm dead drunk. So I stagger. Walk like that. I get vertigo very rarely, but I can't walk. If I was pulled over by a policeman and they wanted me to walk a straight line to see if I'd been drinking, I couldn't do it if I were driving on a day like that.
Let me jump in and ask you, it seems like cycling, and for that matter, driving, would be a little dangerous as a hobby or an activity, right? I'm not sure if I was your wife, I would say, sure, honey, you take the wheel.
Yeah. Ask her if she lets me climb a ladder. But at any rate, what I find is that two things help me during the day when I'm in the middle of migraine experiences. One is a nap in the afternoon, but no more than half an hour. So I set an alarm because if I sleep for an hour, my head really starts to pound and goes off afterwards. The second thing is that because I sleep during the night and my sleep gets disrupted during migraine attacks, I don't sleep as well. But at any rate, after sleeping, I am better than I was before. So I can get up in the morning. If I exercise in the morning, I'm almost always okay on a bike. If I try to exercise at 10 or 11 o'clock in the morning, I will often not be able to.
Yeah, I'm exactly the same. Exercise in the morning sets the tone for the rest of the day. And I'm just a better in everything else that I do when I'm able to do that. And the same is true for me about sleep. Sleep for me personally, as someone who has migraine with aura, is like a force multiplier. If I'm sleeping well consistently with good quality and consistent duration as well. So for me, 8 hours is fine. 9 hours is excellent. And I can operate at 100% the next day if I can get 9 hours sleep, a couple of days in a row. But for so many people, sleep is both a treatment and a trigger. We know that brain health is intimately related to sleep quality and consistency and duration, and same with movement and exercise. And whether that's walking or cycling, those are things that anything that kind of gets you out and about, gets the blood flowing through the veins in the body, I think is is generally sort of great for the brain too.
For somebody who might feel like they're doing all the right things too, and they're not getting better, do you have any words of encouragement?
One of the things I try not to do is to define my life by migraine. I wake up some days and I just don't feel like with the migraine often comes, as I said, a depressed mood. what I have tried not to do is to ever let that get in the way of doing something. So if I'm supposed to be with one of my grandkids who live nearby, if I'm supposed to, one of my other volunteer gigs is I work as a docent in a nearby museum. And if I'm in a headachy mode, which I can get, but I'm not going to let them have me stay home.
Well, I love that, Bruce. Yeah, I love that you're getting back out there and you're not letting migraine hold you back from experiencing the best things in life. We sure appreciate you joining us here on Me versus Migraine and sharing your story. It takes a lot of courage to do that. And we're just honored to have you on our team on the Migraine World Summit.
Well, I feel very honored at having been invited. So thank you very much.
Bruce, thank you for your leadership and support. You've contributed to the Migraine World Summit. You're an integral part of the team there. And many people don't realize just how many people that we have behind the scenes bringing these experts to the world. And so, thank you very much for that.
The self-advocacy and that Migraine World Summit is so much a part of helping people to become better advocates for themselves. So deeply important. I can't emphasize it enough.
Yep.
So thank you.
Yep. It's a great community that we're all fortunate to be a part of. So thank you, Bruce. We wish you the very best. Keep painting and keep writing and keep going.
Thank you, Paula.
Wow, that is an incredible story. And we haven't really heard from somebody who is dealing with vestibular migraine as he has. But vestibular migraine is far more common. We have definitely learned that from the experts we've interviewed on the Migraine World Summit.
Yeah. There's definitely a community of people out there that have been very vocal about it. And a lot of them have said just how disabling and disorientating and difficult it can be to manage. Let's hear a quick clip about vestibular migraine from Dr. Texedo from the Migraine World Summit.
Well, actually, it's quite common. About 25% of migraineurs do experience dizziness at some time, making it perhaps the most common cause of dizziness. In the United States alone, about 2.7% of individuals probably experience vestibular migraine. The reason that some individuals are susceptible to migraine more than others may have to do with a different pathophysiologic mechanism that originates from their genetics. We know, though, that migraine is a genetic disease, but that the expression of the very same genetic imprint may be very different, even among the members of a single family, all of whom have migraine. In fact, I frequently meet patients who tell me that, yeah, we have migraine in my family. Everyone else got it, but I didn't get it. In fact, they did get it. They got theirs as vestibular migraine. And in their case, the cardinal symptom of migraine, headache, isn't even present.
Well, I like what Dr. Texedo says because he distinguishes between vestibular migraine as a condition and vestibular symptoms that many people can have. So there might be a lot of people who are watching this right now who realize, oh my gosh, I've been dizzy, I've been clumsy, I've been, had sort of coordination issues or feel kind of disoriented and off balance. Maybe I have vestibular migraine, or maybe I just have vestibular symptoms.
Yeah. And the fact that you don't even need to have head pain to have migraine, I think that really dispels a lot of myths that migraine is much more than just a headache, and you don't even need headache to have it. The other thing I thought was interesting is that, Bruce said that he was 77 years old, and, I want to thank him for his candor in being so transparent and honest during the entire interview. But when you're approaching like that age, falling over is a really high risk event. Your bone density deteriorates. You could be breaking a bone just by tripping over and falling to the ground. And so if you have vestibular migraine at the age of 77, I mean, Bruce is in fantastic shape, and he's doing a lot of the right things. But that's when your migraine condition can be responsible for broken bones, that's really taking it to another level.
That's right. That's right. People who get into their 70s start to worry about, breaking a hip or something, and he's out riding a bike. I mean, this guy is amazing. I just love his attitude. He's not going to let migraine hold him back from doing the things that he loves or the things that he believes he needs to do to stay healthy, like continue to exercise. So super impressive. I am inspired by that to, not let it keep me from doing some of the things that I love.
Yeah, and I think it's a fine line too. Like, I don't want people in the audience to feel like if they're not in that category where it's not like there's absolutely no way that they could go out and do that. I know, like with some of my migraine attacks, I could be in the best mood and the best spirits and have that really sort of, positive outlook, but there's no way I could sort of do a commitment that I'd previously made when I'm, when my head is buried in the toilet and I'm, physically sick from the migraine attack. And I know that there are people out there that have those types of attacks, but there may be occasions where, if it's not that scenario, or if it's kind of borderline, often it's like, if I make a little bit of the effort, that it is sort of worth it to kind of get out, even if it's just to get outside, a bit of fresh air. You don't have to be sort of cycling for miles at a time. You could be just walking around the block.
Yeah, that is well said. You need to understand what your own limits are, and try to push through them. But it does speak to the sort of anxiety that migraine can breed in people who never had anxiety before. And this kind of brings me back to his discussion of stress. He talked a lot about some of the stressors that he had in his life and trying to limit some of those and build up the resilience. And he also talked about not really understanding what his triggers were. But stress, we know, is a huge one, right?
Absolutely. And we've got a great clip here for talking about stress. Let's have a look at that one.
So stress is the #1 reported trigger for migraines. Many people find things that trigger it, and stress can trigger it for many patients. Up to 80% of patients report stress as a trigger to set off their headaches. And so what's interesting about mindfulness that we're trying to understand is if practicing mindfulness can decrease the likelihood that you're going to experience an event as stressful, or whether or not when a stressful event happens, you're able to better respond to it. There's something called the letdown stress hypothesis, where it's actually the day after or 2 days after Thanksgiving, that somebody's hosted Thanksgiving, that the migraine happens. It's like after the event of all the stress that there's this letdown. And so there's this hypothesis that the stress hormone, or cortisol, that we think may play a role in setting off headaches, it may actually not be the level of that, but the change in the level. So not just on the rise, but in the change. And so if you're able, through a mindfulness practice, create a more steady state of that, so you're not having highs and lows, it potentially could change migraines.
So I love what she says about this mindfulness practice to kind of create the more steady state. And when Bruce talked about painting, I completely related to that, because I paint too. I didn't say I paint well, I just said I paint. But one of the things that I feel when I paint is this sort of meditative focus. So I find that is very therapeutic for me. Good kind of self-care.
Yeah, I really like that idea of just taking a bit of time out, like doing something every day that just brings us a little bit of pleasure and joy. And I mean, it's funny to kind of say that, because it's like, well, life is short. It shouldn't be a large indulgence to be able to do one thing a day that we really enjoy. I mean, I know a lot of us have to work, and we have responsibilities and obligations, but really taking that time out to be kind to ourselves, to do something that we like. And, that's not just good for us and something we like doing, it's good for our health and well-being.
Mm-hmm. Another aspect of Bruce's story that I found to be fascinating was his sort of retrospective. He originally said, my migraine started when I was in my 50s, right? And then he worked until he was 65, and it was kind of episodic till then. But now that he's been working with a headache specialist, he looks back at his whole life and realizes that some of the weird symptoms that he was having in his 20s were actually, and probably, migraine, right?
Yeah.
And it reminds me of that chat I had a couple of years ago with Dr. Alan Purdy, who was the former president of the American Headache Society, who talked about aging with migraine and how migraine changes over the course of our lives.
Yeah, let's take a look at that clip.
This process, whatever is going on in the brain, tends to change over time. The pathophysiologists who come and speak to you will talk about peripheral and central sensitization. But ultimately, And around 39 or 40, and into the most productive years in a person's life, for women, and men, of course, have migraine as well, so the analogy is somewhat similar. They have the most headaches that are the most bothersome and the hardest to treat. Over time, things start to change again. But, you know, as they start to enter over the 40s and then start heading towards 50, 52 plus or minus 2, then another event occurs in women at least, menopause. Then the headaches can get worse, better, or stay the same. And it's hard to predict who's going to do what. And it's very interesting, they may have an increased frequency as menopause occurs. What happens, we think, is the estrogen is the trigger for the headache, and the fall in estrogen that normally is cyclical and monthly starts to fall with ovarian failure of menopause over time. As it falls, it doesn't fall from A to B. It can follow a very jagged course all the way down. If so, there could be an exacerbation of perimenopausal headaches. Shortly after the menopause occurs, however, they may settle down again or completely disappear. And then things change again. And then what happens, which is really interesting, is sometimes they can continue to have the aura, if they have migraine with aura, because 20% of migraine is with aura, and the aura can persist well into the 50s and 60s. And sporadically, it can produce what we call transient migraine accompaniments, right? And what's really cool about that, and I think it is cool because what's more cool than the brain, they can develop these visual auras predominantly, or speech, or arm numbness, or difficulty with speaking, which come on in a flurry over a few days, and then they disappear. And they say, aha, it's gone away. But it hasn't gone away because things change, and it begins again.
It's so fascinating. You know, there's a lot to think about in that. And what I would love to do now is to open it up to everybody who has been watching online with us live. And I would love to get your questions and your comments and your thoughts about Bruce's story, about some of the expert clips that we've heard, and what you can relate to and what you don't understand. That we might be able to help answer for you. This is where it gets really, really interesting about you versus migraine and how you relate to this topic we're talking about today in the story.
Yep. So if you haven't put your question in, you can do so in the chat on the corner here, and we'll hopefully answer some questions.
Okay, now we are live again. I would like to welcome Bruce on screen. Thank you once again, Bruce, for sharing your story. How does it feel to be in the spotlight instead of behind the scenes?
A little weird and a little nerve-wracking, to be honest. Yep.
Yeah, well, we're grateful that you're behind the scenes, or what we do would not go so well. How are you feeling today?
I'm on day 4 of a migraine, so I'm there. You know, I'm just a little off.
You know, I think, unfortunately, there are a lot of people who are with us today live who are also feeling the same thing. I'm having a good day. I'm grateful for, and I wish that for everybody tomorrow. But right now, I just want to get to a lot of your questions and comments, and thank you so much for all of those. And so I'll tackle a couple of those. And if you have any questions specifically for Bruce, he's also here to help answer those. So in no particular order, I'll just start addressing as many as we have time for. Linda Allen says that she experiences spinning vertigo, hearing loss, and tinnitus, all from migraine. And these are some of the stranger symptoms that we hear about. I am really sorry to hear that, Linda, because it must be really, really rough. I note that you did not say head pain or vomiting, and that's a good example of how most people misunderstand the most bothersome symptom. And they don't realize, they think it is just a bad headache. And so raising awareness of all these bizarre symptoms is something that we're focused on from an advocacy standpoint. And so I appreciate you speaking up and sharing that. And I think that one of the things we have to do, you know, Bruce made an analogy to being in the rink with Hulk. I think of the game Whack-A-Mole. And it's like, you know, whack that symptom, whack that symptom. And sometimes you need different tools in your toolkit to address all the different symptoms. We're going to talk a lot today about vestibular symptoms, but all of these can be really disabling. Ciara says, I'm 54. My migraines are more frequent post-menopause, even though I take HRT, hormone replacement therapy, right there with you, and propranolol. And propranolol is a pretty common generic drug that is taken for migraine. It's, I think, a blood pressure medication. So how can I find hope that this will ever improve as I age further? So number one thing I'm going to tell you is have hope. Because in the past 5 years, we have had a record number of new treatments that have been introduced based on new research that identifies the role of CGRP, which is a receptor in the brain. And propranolol, while it's a stable, well-known drug, is kind of considered by specialists to be a little bit of an old school, non-migraine specific medication. As I said, blood pressure. I remember taking it once. If you're not getting better with that, I would strongly encourage you to see a board-certified headache specialist. You might be a good candidate, and some neurologists are also good at prescribing this, fewer GPs, for example. But you might be a really good candidate for some of the new preventive medication that's based on CGRP science. And these are called monoclonal antibodies, and there are 4 of those, or a GPAN, and there are 2 of those that target this CGRP. And if those don't help you, or if they do, you might want to also consider things like behavioral therapy, neuromodulation devices, the SEEDS lifestyle protocol. Bruce talked about some of those that he weaves into his life. And if you want more information on any of those, the Migraine World Summit will give you in-depth information over the past 7 or 8 years worth of interviews with experts. And you can just go in and type that into the search engine and find out anything more you need to know about those. So, wish you hope. So Anna Maria says, I have vestibular migraines. I have the same issues finding a provider to properly treat them. And we know that this is a huge problem. We have a massive shortage of specialists, even fewer who understand vestibular migraine. And some of the specialists have told me that they think vestibular migraine is way underdiagnosed, that it is far more common than anybody knows. And it's just that we don't always associate the vestibular symptoms with migraine. So short answer is you might need to travel to find somebody. I hope not, depending on where you live. I would encourage you to watch some of the Migraine World Summit interviews we had with doctors Michael Texedo, who you just saw within this program, Dr. Shin Bei, and Dr. Frederick Godley, and they are all very well versed in vestibular migraine. There's an organization called VITA that we are a big fan of, and they're one of our partners on Migraine World Summit. They have a provider directory of vestibular therapists and vestibular specialists on their website that you can find at vestibular.org. And I believe we can add the link perhaps in the chat. It's vestibular.org/healthcare-directory or something. And someone also mentioned, this is how I love our community when people help each other. Somebody also mentioned that they've been working with a virtual vestibular migraine physical therapist online for about a year and are making good progress. So take a look at that and take a look at some of the diets and see if any of those things can also help you. Okay, any questions for Bruce, please add those in. He's here and happy to help. I did notice, Bruce, that we had some educators on the line and people here who have been in the school community. Have you found that there are many other people in the education environment who have come to you and say, hey, I'm dealing with migraine as well?
No, and it was a big surprise to me. And what's interesting is that I spent a lot of my years in elementary education, which is about 85, 90% female. So the number of women who probably had some kind of migraine experience was fairly high. I contacted the woman who was the school nurse, who I found out after we were both had left the school that she too dealt with migraine in her life. I hadn't known that. And so I asked her, actually just recently, how many people came to you about migraine and migraine issues? And her answer was, she worked at the school for about 12 years, was 1. And that 1 was 1 more than I ever saw. No.
Yeah. We're not talking about it enough. And I want to make sure we get to as many questions as possible. So I'm going to keep rolling through those. But I do think, Bruce, if you can go into the chat and if there are some questions specifically for you, if you can answer some of those, that would be fantastic. Just in general to everybody. So we'll sort of like double team on this would be great. So migraine at school is sort of the next frontier for advocacy. If you're an educator and you feel passionately about this, our friends at CHAMP, the Coalition of Headache and Migraine Patients, are leading a group called Migraine at School to try to make things different for the next generation and also for educators and anybody working in that space, because it is a huge, huge market, and I'm excited about that. So Vivian said, she said, I've had epigenetic changes in my DNA due to trauma, and I'm refractory to all medication, meaning nothing works for Vivian. I'm on 0 meds for a year now, and I'm hoping that Plum Village and TNH, I had to look that up, will give me the therapy and mindfulness to allow plasticity with the hope of responding in the future. So as I said, Vivian, I looked this up because your story just touched my heart, and I am so sad that you're dealing with this. For those who haven't heard of it, it's a French Buddhist center, and I can attest that prayer and meditation can be incredibly helpful in coping with chronic pain. I hope and pray that you get the miracle that you're looking for. And if you do not, or in the meantime, you can always find ways to build your brain's neuroplasticity and mindfulness. And we're going to have talks on those this year on the Migraine World Summit. You can find some information, but we're going deeper on this topic because it's something that we think can potentially help a lot of people. So you go to Migraine World Summit and you type in mindfulness, you're going to find a whole bunch of resources there and more coming this year. Karina mentioned being clumsy and brain fog is not discussed very much, and she's discovered that they're part of my migraine. Brain fog, we are talking a lot about on the Migraine World Summit. Clumsy is an area I want to double click on because I get clumsy as well. I'm nursing an injury in my arm that I got yesterday when I wiped out. And I thought, what's going on with me? Because I'm normally not that clumsy, but there are times when I am. Do you ever experience that, Bruce?
Well, I experience it quite a bit. And, for me, what's interesting is you think about the mind-body, the experience, or the, hand-eye coordination. That's what's missing for me. Mm-hmm. So it's not just clumsiness and not paying attention because I have brain fog, although that also is going on usually. But what it means is that I actually don't know when I bend over to a drawer or into in the kitchen, I'm opening a cabinet that's below and I'm pulling out a pan, and then I go to close the cabinet door. And I actually don't know where my head is in relationship to that cabinet door. So wow. I'm just as likely to slam it into my head as not. Right? Or I drop the soap like we all do in the shower. And I had to install grab bars in the shower because I don't trust myself in the shower anymore. So I grabbed the grab bar, but even with my hand on the grab bar, as I go down to pick up the soap, I come up and I hit my head on the grab bar.
So there's the tip for the day, everyone. Install grab bars in your shower because you do not want to wipe out in the shower. It's ugly, right. And then somebody has to rescue you. So they're not too expensive. They're like $20 at Home Depot or something. And I think they even make them now where you don't have to screw them in. You can just like press them on the wall. So that's a really good tip. And I want to pick up at one of the questions that came in, which is what is Alice in Wonderland syndrome? And it's defined classically because Lewis Carroll, the author of Alice in Wonderland, had migraine. And so he describes this whole thing of, your head's getting big. And Bruce described, the person he was interviewing and their shoulders like moving up and down. And he just described like leaning over and not realizing where his head was. And it's this dissociation that the brain makes between your limbs and your body and where they are, and seeing your hands and things as being bigger or smaller. So that's kind of what Alice in Wonderland syndrome is. And we've got some information again on Migraine World Summit about that if you want to learn a little bit more. I saw a great question about finding resources, and especially when you're in a place like Saskatchewan, Canada, like Dion is, and you're thinking, is there anybody here who knows anything about migraine? The answer is yes, and we're getting more all the time. It's one of the reasons why the summit exists, but Dr. Elizabeth Leroux is head of Migraine Canada, and on the migrainecanada.org website, you'll find a clinic directory, and I looked and I found one in Saskatchewan. So you're in luck. And I hope that you get some help there. If you don't, there are some other great clinicians in Canada, in addition to Dr. Leroux and Dr. Christine Lay and some others who may be able to help you and get you the care that you need. Becca asked, and I thought this was a brilliant question, one that I've always wondered about. Do all migraine preventives fade in usefulness over time? And how long do they last? So, Becca, I'm thinking you should go into research, because this is a question that researchers have not yet been able to answer. We don't really know, honestly. Clinicians tell us that they see both. They see a few different kinds of cases. They see people whose brains get better with a medication. They see people who can stay on one medication for life, or one therapy type for life. They see people who age out of migraine and have less need for their preventive therapy. And then they see people who get maybe 6 months or 18 months of relief, or a couple years of relief, and then they need something new. Their brain's like, next. And we heard that from Bruce and his sort of trial and error with different medications. I also had a whole series of ones that I went through and tried. And I found my path to migraine freedom a little bit different than some others. But it's very individualized, just like our biology. And there is something that we publish as part of the Migraine World Summit called the Migraine Treatment Directory. And in that, you will see the entire list of anything ever reported by any of our experts as a migraine preventive. And so if you ever wonder, like, what list is my doctor looking at, that is going to be a great reference for you. So check that out. Marie asked about IV therapy. And I believe, Marie, you're talking about one of the 4 monoclonal antibodies that have been introduced in the past 5 years. These are the new drugs that are targeting CGRP receptors in the brain. And Marie's question said she had some concerns about it being invasive. That's because this IV therapy, you go to an infusion center, and or I think they do have some home infusion services, and you can get that. So there are drugs in the same class that are injectable. And these are like Aimovig and Emgality and Ajovy and Vyepti. These are the 4 drugs in this class, and they come in different forms. And there are similar class of drugs that are oral medications that are considered to be GPANs, and those are also being approved for preventive use. So you do have some options in that space. If you may or may not be ready for IV, you and your doctor can decide what is best for you based on the way your migraine presents. So, okay, I'd like to thank Kelly, who's helping us with all the questions today and getting those queued up so we can answer them as well as possible. And we only have a couple of minutes left. I want to respect everybody's time and get to a couple more questions. Let's see. Depression associated with migraines. Yes, B asked this question. And it happens in, some say a third, some say half of all cases. There's varying levels of research that depression is associated with migraine, particularly when you get into chronic migraine. the 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 situational depression and the chemical depression are both factors that are going on and highly associated with migraine. We have a number of talks on the Migraine World Summit that go deep on this and what's going on in the brain that links the two, and then some strategies for treating both, because there are some medications, antidepressants, that are used to target serotonin in the brain and try to recalibrate that to treat both of them. But it is a really difficult double burden that so many people face. And I encourage you, if you are struggling with that, to talk with your physician about, which one is more severe and where do you start, right? Because that's oftentimes difficult. If migraine is more difficult, then maybe the way you treat migraine can also help your depression. If the depression is more severe, maybe start on that first, and maybe your migraine case will improve as well. So those are all possibilities, but I'm sorry that you're dealing with both of those things.
Well, maybe one thing I could do is respond to a number of questions that were asked. LB asked the question, how does a teacher like myself work with our school boards? And I'm going to generalize that just a little further and say, if I'm an employee, how do I work with the people who employ me? And as a person who ran schools, and so therefore was the employer, the boss, so to speak, one of the things that I find when there has been a question of how to deal with a problem that somebody is having and accommodations that they need, we get really nervous talking about it to our bosses. And there's a reason for that. Part of it is internal, so it's just that we're scared. And part of it is external. Some bosses aren't so understanding or empathic. And but what every boss knows and understands is the work that needs to get done. So it seems to me that the way to approach your supervisor is with, I need an accommodation. I also need to get this work done. This is how I would suggest doing it, making it happen. So whether it's, people have talked about smells and being in the office, or light and being in the office. I'm very light sensitive. Or other things like that. Or I'm going to get back to the school specific answer, particularly in elementary school. If you have a class of 22 children, age second grade, you can't just get up and leave them for an hour. It's impossible. So the accommodation has to figure out how to manage that. But every job has that. You're on a plane, you're going to here, you've got a conference where you're presenting for the company, you're whatever it happens to be. So the question then becomes, how do you think with your supervisor about how to get done what needs to get done before the crisis occurs? And I think when you think like that, generally, for most people, unless the boss is really obtuse, and I'm going to use that word, in which case I would suggest quitting. But I think that unless the boss is like that, you can usually find some way to accommodate your needs.
Yeah, thank you, Bruce. If you guys have more questions for Bruce, I would encourage you to go to worldhealtheducation.org and just send us a message, and we'll get your questions to him, and he'll be able to answer some of those. But some great advice. Bruce, thank you so much for joining us here today.
You're welcome. Thank you for inviting me.
Thank you for sharing your story. It takes a lot of courage to do that, but I hope you hear and feel just the gratitude from the community for you coming out and sharing your story. Everybody can give us a round of applause for Bruce. And we all appreciate your advocacy in the community and what you're doing to make life better for people with migraine.
Thank you.
All right. Be well, Bruce. Thank you.
Thank you.
Okay. And I want to thank you for joining us on Me versus Migraine. If you have a story like Bruce's that might help others, we would love to hear it. just send us a message through our website at worldhealtheducation.org. And you can also subscribe to all of our Me versus Migraine episodes. And there are many good ones at worldhealtheducation.org. This episode was produced by the World Health Education Foundation in association with the Migraine World Summit. Robin Rock, Lydia Evans, and our guest, Bruce Shaw, contributed to the production, as well as Kelly Pokrivka. So thank you, Kelly. And thank you, Carl. We wish you all the best for joining us on this episode of Me versus Migraine. I'm Paula K. Dumas, wishing you strength for your battle with migraine. Take care, everybody.